Today, the country surpassed 20 million cases, and we're looking at 222,000 deaths in the country. Many experts are saying this is a huge undercount of the cases and the deaths in the country. How are you observing it? What is exactly going on in India? How did this surge become so bad?
So Aditi, the first thing first is this is so unfortunate for our country. It is heartbreaking. I have so much sympathy for the first responders, the people of India. The government, the administration, the health unit did not work together, did not do appropriate communication to people, and prematurely announced the victory over COVID-19 pandemic back in February. Very unfortunate circumstance for the country. We could have done a better job by communicating this to our people, not to do many events, super spreader events, which we had done. And it is very unfortunate for our country that, and the numbers, like you said, coming out is probably 3, 4, 5 times more than we get from the government.
Right. So do you think Prime Minister Narendra Modi is responsible for this surge? He did let Hindu Festival of Kumbh Mela take place. He did let election rallies take place. Do you think it's his fault?
Not only the government, I think everyone else is also responsible. The healthcare, the healthcare providers, the healthcare in the government system, they should also be responsible. And above all, the people in India also should be responsible. There are a few things I want to reiterate here. We have a very poor infrastructure, low testing level, underreported cases, human error, and no requirement of reporting. So what happened after November 2020, what happened from November 20 until March 2021, the number of cases, actual cases going on in India were underreported. So I think the government also responsible for not taking care of that. And I think people got the wrong message. The communication was not the right.
What are some of the conditions, because I'm sure that you are in touch with some doctors in India. What are the situations that they're telling you is happening in the hospitals? What is the real case that's going on?
So right now, two important things is happening in India. The oxygen concentrations, the oxygen levels, the supply of the oxygen is not there. The bed for the critical patients are not there. So people are advised to stay home, get to their temple or the Gurudwara and get the treatment, oxygen treatment there. Very unfortunate circumstance for our country. We should be prepared. And I think this was expected that the second wave definitely will hit India sometime this year. It reached very quickly.
Right. Certain states in India will go into lockdown in the coming days, or that's what we are hearing. Do you think this lockdown should happen right now?
It should happen yesterday actually. It is too late now to do the lockdown because the number of cases, people are on the streets right now waiting in the line to get the oxygen, to get into the hospital. They have money but they cannot get the hospital bed. Very, very unfortunate situation right now.
Right, and there's another question about vaccine, Dr. Patel. We're hearing that India would like to have the intellectual property of vaccines such as Pfizer. Do you think United States should share that information so that we can start vaccinating more individuals in India?
In fact, the government of India had enough vaccination initially. I think they distributed to other country on a good faith. That was not a good call. However, whatever the help they can get right now from the foreign countries, I don't think the UK has any supplies. However, the United States may have excess supplies and they should reach out. And the government of US, Biden administration, should definitely lend their hand to get the vaccinations to India. Because what happens in India definitely will impact the US and other countries as well.
Right. Now, I'd like to actually know, how do you think it will impact the rest of the world, including the United States? What's the worst case scenario you're seeing here?
So the mutant variant comes to the US sometime within next few months. That will be a very dangerous situation for us. Luckily, our vaccination rate is good right now. About 45% people got at least one dose of vaccine, but we still need to reach 80%. If we don't reach that 80% threshold, I think we will be in trouble from that variant as well.
Right. For India, what's your biggest advice for doctors right there?
The biggest advice right now is people to stay calm, stay home. I know they cannot live without oxygen, so somehow the temples, the gurudwaras, the churches, all the religious places should open up their own oxygen centers where people can get the oxygen, where they don't need the acute treatment just because lack of oxygen can save their life. So if they get the oxygen at those centers, at the public places, I think that will be the best thing, because the hospital system is totally crippled right now. There are no beds available in Delhi, Mumbai, even in Gujarat. So I think the situation is very grim.
What's your prediction for this month? We're hearing that India may hit its peak in the coming days.
May 15th is the peak time. So from May 15th, another couple of weeks, by end of May, we should continue to see rising cases in India. And after end of May, early June, the situation may get a little better.
Right. Let's now talk about the United States, Dr. Patel. The biggest news that's coming in this hour is the fact that President Biden has announced that about 70% of U.S. adults would have had the first dose by July 4th. It's quite a big goal. How are you looking at this?
It's a very ambitious goal. We can reach there. However, let me tell you statistics what's happening right now. Only 32% people are fully vaccinated in this country, about 44% at least one dose. The problem is the vaccine 65 and older, only 65 to 68% people are fully vaccinated, and 80% received only one dose. So, and on the younger age group, from 18 to 30, about only 35% people received the vaccine. So if we don't reach that 80% threshold for that vaccination, we will definitely be in big trouble coming fall and winter time. So I think 70% is a good goal, but we do have our own challenges in this country. There are people who don't want to get the vaccine because they don't believe in science, ignoring the science and the vaccine. The other group, they have the vaccine fear and misinformation. And the last group, they don't have access, lack of access or resources. So I think the last two groups, if we can get those last two groups, get the vaccine within next few months, by end of summer, we will be in good shape.
Right, and talking more about vaccines, Dr. Patel, we're also getting the news that Pfizer may get approved for 12 to 15 years old. They may have the emergency use authorization by next week. Could this be a game changer if more children are vaccinated? Is this how we're going to reach that 70% herd immunity?
Absolutely. So once the Pfizer vaccine received the emergency authorization for age 12 to 15, our eligible population in this country will reach 85%. That will be a huge game changer. That will allow us to get that herd immunity reached very quickly.
Right, and when you're looking at even younger children, doctor, what are you hearing about vaccination efforts for that? Is it safe to vaccinate children as young as 2 years old?
So in September, Pfizer will submit the emergency use authorization for age 2 to 11 age group. And I'm pretty sure FDA will approve that. And if that happens, going back to school in September will be much more easier, and the young population definitely will benefit from that.
Right. More on vaccine, Dr. Patel. J&J, the Johnson & Johnson vaccine, has been reinstated back. It was paused for a little bit due to these blood clots that were seen in women ages 18 to 48. Now, my question to you is, how do we decrease this vaccine hesitancy that has started since that pause happened? And for women ages 18 to 48, do you think they should opt for the other vaccines and not J&J?
So if they are on birth control pills, if they are a smoker, if they have some risk factor of getting the blood clots, they should avoid getting the Johnson & Johnson vaccination. But other groups, they should not be worried about Johnson & Johnson vaccination. It is very effective vaccine, very safe vaccine. Side effects are extremely rare. Like we had in the past, smallpox, polio and yellow fever vaccine. It develops within 6 weeks of time, and the ratio of the side effects is very minimal.
Right. What do you say to anti-vaxxers? Because there's a growing community of them, and I believe we need them to be vaccinated to reach again that herd immunity.
Absolutely. My message to those individuals: believe in science. We are not 200 years behind. Right now, with the technology, with mRNA technology and the vaccination, the vaccination was developed in a right time. In fact, the vaccination took a little longer than I suspected. So the vaccination is very safe. It is very efficacious. The data shows that the vaccine definitely saves lives. Vaccine definitely reduce the complications from the severe infection. So I think all those information needs to be communicated with those individuals who are refusing the vaccine, because they will also affect us, those people who receive the vaccine, and will delay the process of getting this pandemic over.
Meanwhile, Dr. Patel, New York, New Jersey, and Connecticut just announced their plans of reopening by May 19th. I'd like to know, is this happening too fast in these areas which were once the epicenter, and what should that entail?
I think right now in this tri-state area, we are ready to open up. We still need to take some precautions for indoor setup. We still need to wear the masks. Social distancing has to be observed when we are in the restaurants and closed spaces such as indoor games or all those venues. However, when you are outside, if you're fully vaccinated, there is no reason for you to get panic. And I think most of the places in our area are ready to be opened up.
Right, and you're just talking about those guidelines. The CDC came up with these new mask guidelines last week for these fully vaccinated people, basically saying that they don't have to wear masks in certain conditions. My question to you is, while we are still waiting for the country to be vaccinated, is it wise for the CDC to come out with a guideline such as that?
I think so, because those people who are fully vaccinated, they should get some benefit versus those who did not get the vaccine. So I think that will be an incentive to get more people vaccinated. So I think some relaxation needs to happen right now for those people who fully vaccinated with 2 doses or 1 dose with Johnson & Johnson vaccine.
Right, but doesn't having unvaccinated people around us impose a threat to those vaccinated people?
It does, and that's the whole reason that if you are vaccinated and going with non-vaccinated people has to ensure that they are fully protected by wearing the mask and social distancing themselves. So I think it's a catch-22. If we don't do it, it is a problem. If we do it, it's a problem. So I think it has to be a common sense approach, and some activities can be done, but we still need to avoid some activities where we can spread the virus in an indoor setting.
Do you think restaurants and several other businesses that have, crowd-facing employees and have a lot more people in their businesses, do you think they need to make sure that they continue to have mask guidelines?
Absolutely. They for the indoor setup, I would strongly recommend that the government should ensure that they wear the mask for the indoor for the staff of the restaurant as well as the customers.
What's your biggest fear right now, Dr. Patel?
My biggest fear right now is India. The variant from India, the mutated virus in the US, can cause a lot of trouble. Few states are already in that stage right now. Oregon and Colorado, they have number of cases are rising. Our number of cases are 50,000 every single day. In last 1 week, we had close to 370,000 cases in the US. So we are not off the hook yet. We still have concerns, and I think that is my biggest concern, that the variant coming from other countries like India and UK can definitely cause a troublesome scenarios for the US.
Just 2 more questions left here for you, Dr. Patel. How are you looking at South Asians right now that are living in this country, especially the ones at high risk? Are they still under threat with COVID?
Absolutely. The minority communities, the South Asians, the Hispanics, and the African American, those who don't know their medical status, they may have cardiac condition, they may have diabetes, they may have many other chronic medical conditions. They are at high risk of getting COVID-19 infection even after getting the vaccine. The chances are getting after the vaccine is pretty low, but the variant can definitely hurt them. So they all need to be very careful, and that is my biggest concern right now in the US.
Do you think those people should wear more masks?
I think those people should avoid going in the public places if at all possible. They can do small gatherings with their immediate family, with their loved ones, with their known friends who are vaccinated, but avoid big gatherings overall, in my opinion.
And finally, what is your prediction for the rest of the month? There are a lot of states easing restrictions. How is that going to affect cases and deaths?
So I think if the cases are increasing and if you're getting more people vaccinated, and my sincere guess is if we get about 70% people vaccinated by end of July, I think we will be in good shape and we don't have to worry about this fourth or fifth wave coming in the US. But if we are at the plateau right now in the US as far as the vaccinations, we are under 200,000 vaccine every day. I think we reached 350,000 at one point. Now it's only 200,000. So we are at plateau. We need to increase that number. Our community, the local government, the state government needs to ensure that they call people, they go to people's house to get them vaccinated. The temples, the churches, all those places needs to be used to get people vaccinated as quickly as possible within next 2 months.